Hello and welcome back to the channel. Today we're diving into antiretroviral therapy. What it is, what it does, the different drugs involved and how they work in the body. Stay with me until the end. I promise you will leave this video confident and informed. Let's jump right in. Let's start with the 5 big goals of ART. These are the reasons why we give HIV patients this treatment. Goal number 1. Reduce the virus in the body. ART aims to reduce HIV to undetectable levels. That's right, undetectable. This has to be maintained to stop the virus from becoming resistant and making the disease worse. Goal number 2. Support the immune system. When ART is working well, CD4 cell counts increase around 100 cells per cubic millimeter per year. What's the big deal about CD4s? Well, they are your immune soldiers. With enough of them, the body can fight off infections. Sometimes if a patient already has an opportunistic infection, ART can help shorten it or make it less severe. Goal number 3. Improve quality of life. Let's be honest. HIV is not just a physical disease. It affects every part of a person's life. With ART, patients feel better, gain weight, have more energy, and return to work and family life. This brings back hope. Goal number 4. Reduce HIV-related illness and death. ART stops HIV from progressing and turns the tide on the disease. No more frequent hospital visits, fewer chances of dying from AIDS. Goal number 5. Reduce the risk of transmission. Higher viral load equals higher chances of spreading the virus. ART lowers this risk. It's especially helpful in reducing mother-to-child transmission and during sexual activity. Now let's look at the principles that guide how ART is given. First principle is to improve adherence. So patients must take the medications exactly as prescribed. So the wrong dose, missed pills, that gives the virus time to mutate and become resistant, like a thief learning your security system. Principle number 2, use combination therapy. So 3 or more ARV drugs from at least 2 different classes. So the most common combinations that we have is where you have 2 nucleoside reverse transcriptase inhibitors plus 1 protease inhibitor. We have also a combination where we only have 2 protease inhibitors. We also have a combination where you have 2 nucleoside reverse transcriptase inhibitors plus 1 non-nucleoside reverse transcriptase inhibitor. So this prevents the virus from adapting. Principle number 3, choose the right combination. We want something that's effective, tolerable, simple to take, like once or twice daily, and then flexible for future treatments. Principle number 4, delay resistance. Even in perfect conditions, 20 to 40% of patients would develop resistance in 5 years. So we must pick strong drugs, educate patients, ensure a steady supply, monitor their response, because resistance is like the virus putting on a shield, and once that happens, that drug is useless forever. Worse, it might become resistant to other drugs in the same class too. Let's talk about how these drugs work. Each type targets a different part of the HIV life cycle, like a football team targeting different parts of the field. The first group that we're going to look at are the nucleoside reverse transcriptase inhibitors. the NRTIs. These are fake building blocks. When HIV tries to build its DNA, it grabs these by mistake and ends up with a faulty structure. Examples of such drugs include zidovudine, which is also known as AZT, lamivudine, 3TC, tenofovir, TDF, abacavir, ABC, amitriptyline, FTC. Now, a combination is made such as Truvada, which is a combination of tenofovir and amitriptyline. Cobiva is also made, which is a combination of zidovudine and lamivudine. Tresiva is also made, which is a combination of 3 drugs, which is abacavir, zidovudine, and lamivudine. Another group that we can look at are the non-nucleoside reverse transcriptase inhibitors, the NNRTIs. These directly block the enzyme that converts RNA to DNA. Examples of such are the efavirenz, nevirapine, rilpivirine. So, one pill regime or a combination that is made, we have a tripla, which is a combination of efavirenz, amitriptyline, and tenofovir. We also have another combination, which is Complera, which is a combination of rilpivirine, amitriptyline, and tenofovir. Let's discuss another group, which is the protease inhibitors, the PIs. These block the protease enzyme, which HIV uses to chop its proteins and make new virus copies. Examples of such drugs, we have ritonavir, a combination of lopinavir and ritonavir, adzinavir, indinavir. So, these protease inhibitors, they are often combined with NRTIs to reduce resistance. Another group that we can look at is the entry and fusion inhibitors. These, they stop HIV from entering the CD4 cell. Example of such drugs is influvetide, which is an injectable, and then there's also an oral drug which is very effective in resistant cases, which is malaviroc. The last group that we can discuss is integrase inhibitors. These, they stop HIV from inserting its genes into human DNA. Examples of such drugs is rotagravir and elvitegravir. Art saves lives, but like all medicines, it can come with side effects. Common side effects include lactic acidosis. This is rare but life-threatening. High risk in pregnant women on stavudine and didanosine. Liver toxicity, more common with nevirapine. Hyperglycemia and diabetes, especially with protease inhibitors. Fat maldistribution and high lipids, again common with protease inhibitors. Bone loss, common with protease inhibitors. Pancreatitis, common in stavudine and didanosine use. Rash, common with nevirapine. Bone marrow suppression, common with zidovudine. Kidney stones, common with the use of indinavir. Central nervous system effects like nightmares, common with efavirenz. So, how can you manage these side effects? First, you need to educate your patients before starting ART. Choose drugs wisely based on the patient's condition. Do routine lab and clinical monitoring. and also be available when your patient has concerns. Also watch out for drug interactions because some ARVs weaken birth control, and never mix rifampicin with protease inhibitors or non-nucleoside reverse transcriptase inhibitors because it leads to liver damage. Also be aware seizure medications and statin drugs all interact with ARVs. And there you have it, the full guide to ART, what it does, how it works, and how we manage it. ART isn't just a treatment, it's a lifesaver. When taken properly, it can help people with HIV live long, full, and healthy lives. If this helped you, give this video a thumbs up, drop your questions in the comments, and don't forget to subscribe and share with your classmates or colleagues. See you in the next session. Stay safe and stay smart.